Imagine working for decades to eliminate a deadly disease and losing that achievement in just 1 year. That's exactly what just happened in Canada. And shockingly, one province is being blamed the most. Canada, a country once praised for having zero measles transmission, has officially lost its measles elimination status, a milestone we earned in 1998, gone in 2024. So what went wrong? According to several former top health officials, Alberta played a major role. This year alone, Alberta recorded over 1,900 measles cases, accounting for nearly 38% of all cases in Canada. Dr. James Talbot, former Chief Medical Officer of Health for Alberta, didn't hold back. In his words, "We worked for years to eliminate measles, and we lost it because we failed to act." He says the province should be embarrassed and owes an apology to Canadians. Measles is not a mild childhood rash. It is one of the most contagious viruses on the planet. Just one infected person can spread it to up to 18 others. Across Alberta, doctors had been raising alarms for months. Vaccine messaging was weak, hospital systems were overwhelmed, immunization rates kept dropping. And in the middle of all this, a heartbreaking tragedy. A premature baby died after contracting measles. Doctors say this didn't have to happen. Pediatric specialist Dr. Sam Wong says the government didn't act fast enough. The seriousness was underestimated. The outbreaks in Alberta became so large that at one point they recorded more measles cases than the entire United States. Even healthcare associations are calling it a collective failure. They blame misinformation, low vaccination outreach, and delayed action. But the Alberta government defends its response, saying vaccination clinics were expanded, new outreach programs were launched. More than 137,000 vaccines have been administered since March. They believe the spread is now slowing down. Experts, however, warn that slowing down isn't the same as stopping. So what needs to happen next? Doctors across Canada say the solution isn't complicated. Make vaccinations easier. Build trust with communities. Get childhood vaccination rates above 90%, because measles doesn't knock politely. The worst as a bottle but it spreads like wildfire wherever vaccination levels are low. Dr. Karina Top says, this is a wake-up call. We must rebuild trust, raise these and rebuild the system. Canada can regain its measles-free status, but only if transmission stops completely for at least 12 months. Until then, the message is simple. Prevention is easier than regret. Vaccines save lives.